All right, so this is a wound care demo, primarily to emphasize the importance of separating clean and dirty when you're doing wound care in the home and cleaning your hands in between these steps. Perfect. So for the purpose of this video, this patient has a wound that is a lot more intense than what the wound care items selected would be used in real life. But again, this is to focus on the difference between clean and dirty. So as you can see, we have a clean setup over here, which we labeled to be able to easily differentiate the difference. This setup would probably happen on a bedside table or on a table or surface in the patient's home. And Lynn, how do you know what objects on that thing are clean, or how did you set that up?
So the dressings came from unopened, clean, unused packaging. The spray and the hand sanitizer and the wipes were put away clean in my bag, and they were stored in the clean area of my bag. Okay, the first thing I'm gonna do is clean my hands. And now my hands were dirty when I touched this, so I'm gonna put it down on the dirty side. Clean my hands. I'm gonna put on my gloves. And I'm going to take off my dirty dressing and put it on the dirty side. And now I'm going to take off my gloves, clean my hands. Put on a clean pair of gloves. So you want to make sure you have a good supply of gloves when you do wound care, because you're going to go through a lot of them. Now we're going to clean our wound. I'm going to spray.
Oh,
I'm spraying in cleaning my wound. Since my hands are clean, this is still clean. I'm putting it back on the clean side. I'm taking my gauze and I am cleaning my wound. Putting that in the dirty. Taking off my dirty gloves. Washing my hands. Putting on a new pair of clean gloves. Clean dressing. Before I take off my next dirty dressing, I'm going to take off my dirty gloves. Oops. Actually wash my hands for real pretend. Put on a new pair of clean gloves because we don't want to cross-contaminate or have any risk of cross-contaminating from one wound to the next wound. We're going to take off the dirty dressing. Gloves, wash our hands, and yes, you will have a nice thick layer of sanitizer on your hands.
yes. And Lynn, would you want to do anything if you uncovered that second wound and realized you wanted to change what the wound care could be?
Yes, thank you for asking. So when we opened up that wound, it was pretty gnarly, and we probably needed a different wound plan. So in that case, after taking off the dirty dressing, you would take off your gloves, wash your hands, make sure your patient's safe, step away, call the provider, get your new wound order, and then come back and wash your hands, put on new gloves, get the supplies, or you have the supplies you need, and then dress the wound.
Yep.
But the important step is getting your verbal order before initiating the new dressing.
Yep.
Okay, so I washed my hands, new gloves, spraying on the wound. We're all still clean. Getting my gauze, cleaning the wound, taking off my gloves, washing my hands. And I'm sure when you do this, you won't have any of these creases on your dressing. And clean again. Now I would clean my I'm just going to go ahead and clean this. Doesn't hurt.
And if during the wound care you picked up that spray bottle to continue cleaning and got it dirty or set it down in the dirty section, you would want to clean it off with those wipes prior to placing it back onto the clean side.
And after you clean it with the Santa cloth, you would let it dry per the instructions on your whatever type of sanitizer cloth you have.
Perfect.
That's your demo. Thank you for watching.